You won't believe what I had to do in order to get this patient the surgery that he desperately needed when the insurance company said no. And I said, not on my watch. So I had a 45-year-old male patient who presented to the clinic after a jump off of an 8-foot wall. Long story, but anyways, after the fall, he went to the urgent care and he was not given a boot and they did not diagnose the fracture. He was sent home. He came to my clinic and we immediately identified the fracture at the level of the Achilles tendon where it inserts. So it's at the back of the heel. There's a big bump. He fractured off that bone spur. So afterwards, we submitted for surgery. We said, hey, by the way, you can do the conservative therapy, but he's like, it hurts too much to walk. We talked to him and he wanted to go forward with surgery because he's like, I can't walk, I can't take care of my kids, I can't work, so I need to do something about this. We know we scheduled for surgery. However, the insurance company immediately said no because they said, hey, you have to try physical therapy, you have to try other measures. But without talking to me or asking what had happened, they just straight up denied it. So we had to cancel the patient's surgery, which he was already scheduled for literally the day before. And it took an extra 2 weeks for me to kind of contact the peer-to-peer and say, I can't accept this. This patient needs a surgery and this is why. So it's really important to identify that if the insurance company says no, that the doctor advocate for the patient, because on the other side of the insurance company, there is also another doctor who's reviewing your case, but they don't know the patient, they don't know why. So I had to call the insurance company and say, hey, this is actually why. This patient can't walk, this patient can't take care of their kids, it's hurting too much, kind of make a case for it essentially. So then we finally got the approval. So I feel like that's a win for the patient, but I really feel like that's a win for me because, it's really important to, especially for people who are actually hurting, to get the care that they need. So that's that for today.